Hello and welcome to the NewsX Sunday Guardian Roundtable. Well, the COVID second surge is here upon us, and while it seems to be abating in the cities, it's not that is not really the case in various regions, especially in the rural India. So we have to be really on our guard. But what is the difference between the second surge and the first episode? Why is the second one more lethal, despite the fact that vaccinations have happened, and also the implications of long haul COVID? That's something most people are now suffering from. Are the in fact, some of the cases are worse than COVID itself. To join me on this, to explain some of the facts, and also whether post the two vaccinations do the long haul symptoms become easier, and of course there is the threat of the black fungus. We also told there's a white fungus, there's a yellow fungus, so a lot of fallouts from COVID. To explain this and make it easier for all of you, I had joining me a panel of doctors. I have Dr. Monica Mahajan. She's Director Internal Medicine at Max Hospital. Dr. Harsh Mahajan, he's founder Mahajan Imaging and Chief Radiologist there. And Dr. Barnali Datta, she is Director Respiratory Medicine at Medanta Medicity. In fact, as you know, lungs are one of the complications are really in the lungs, Dr. Datta. So can you just explain to us as to, what people, why are the lungs being so affected? And post-COVID, I think lungs are one of the areas to watch out for.
Absolutely, Priya, that's exactly what we are seeing. I mean, COVID essentially is a viral pneumonia. So, of course, the lungs are bound to be affected. There's a great difference in what we saw last year and what we saw this year. Last year, it was a viral pneumonia, but there wasn't, the extent of lung involvement was not tremendous like this year. 50% lung involvement was majority what we were seeing. This year, it's everybody's got 80 to 90% of lung involvement. And by lung involvement, I mean pneumonia, consolidation. The lungs from being sacs of air become solid. And obviously, then they lose the capacity to, take in oxygen. And so this year we've had young people, fit people with no comorbidities coming with scores of, 90% of lung involvement. The CT scans we see, the X-rays we see, which should show black lungs, show completely white lungs. And that the oxygen intake is going to be extremely difficult, and they're all on high flow oxygen. And the reason for this obviously is that we know that this variant that we have encountered this year is far more virulent, far more deadly than it has been last year. Last year we had some handle on things. We knew we had sort of been reasonably good at predicting. The comorbidities were elderly, diabetes, obesity. This year there seems to be no pattern. The age doesn't matter. Everybody is suspect. Everybody is affected, and the severity of disease can be tremendous in any age group. And so that has made us think that the new variant that we're dealing with in India, the double mutant one, the B1.617, is, it has different types. And obviously, we're dealing with a very virulent one that has caused, this extent of lung involvement. I suppose the other thing to point out is that, what we deal with is our body's, exaggerated immune response. And that is what is called the cytokine storm. I mean, the virus, of course, comes and, it triggers the whole thing, and then the virus disappears. The virus becomes irrelevant. And then what we are dealing with is this huge, cytokine storm in our bodies that makes the lungs white out completely. And then the entire treatment plan is trying to manage it at different levels, medically, ICU, etc.
Monica, a little bit more on this also, your experience of and also the post-COVID implications, really, if we can first focus on those.
Okay, so what we need to understand is that there are two phases to this illness, or rather three phases to this illness. There is the first phase where there is the virus which is replicating or multiplying in the human body. And then once that replicative phase or multiplying phase of the virus has become over, it kind of overlaps with the inflammatory phase, which is the body's immune response to this virus attacking it. So the double whammy is that you fall sick during the replicative phase of the virus. But by the time you end up in the hospital, the body's immune response, instead of being protective to you, has become so exaggerated in terms of what was called as the cytokine storm by my other colleague, that starts to cause more havoc in the human body rather than in terms of saving the human body. So we have various chemicals which are released in the human body as a response of this inflammation. So those chemicals start damaging the internal organs of the body, whether it is in terms of the lungs, whether it is in terms of the heart, whether it is the liver or any other system. So where the inflammatory process was supposed to stop after fighting the virus, it becomes out of control, out of bounds. And that is that cytokine storm which starts to cause problems and kill a person. And then is the third phase where you are out of the COVID phase, but it's the post COVID phase where there is an ongoing inflammation, what is called as a multi-system inflammatory syndrome, that people have recovered from COVID, gone home, and yet you have these people coming back with recurrence of a fever, a lot of joint pains, body aches, lack of focus, concentration, weight loss, anorexia, and whole lot of other symptoms in terms of the post-COVID ongoing inflammation in the body, which nobody has an explanation to as to what exactly is triggering that off. And same way, the treatment has to be tailor-made in the sense that there are certain drugs which have to be given in the replicative phase, where there are other drugs which should be avoided in the replicative phase. So until and unless we understand that the multiplication of the virus is happening in the first 7 to 10 days of the illness, and post that the virus stops to multiply, but it has already started causing a cascade of damage in the human body. So the drugs that are targeted for preventing the viral multiplication have to be given in the multiplication phase, whereas the drugs which are supposed to target the inflammation have to be given in the inflammation phase. So if you don't get your fundas right and you start mixing the drugs as to what needs to be given in phase 1 and what needs to be given in phase 2, that is what is creating the problem. So there are different phases of the illness which we need to tackle. We need to understand as to when is the virus multiplying and when is the cytokine storm or the inflammation in the human body causing problems. And that is where the treatment guidelines should be supporting us in terms of managing this patient.
Thank you. Very well explained. Dr. Harshmajan, the fact that, even after 2 vaccinations, does that have an impact on long haul COVID? And the fact that, what are the symptoms that people should be looking out for? Irregular heartbeats, increased blood pressure, sugar?
That's Priya, very interesting question you asked, and probably no one has an answer to that question, whether being vaccinated after COVID in any way is going to affect, the post-COVID or the long COVID symptoms that are there. Maybe in the coming months, we will know more about this and whether it will change in any way the course of the long COVID or even the long haul symptoms that appear to continue. What we do know is that between the second wave and the first wave, there are differences already pointed out by Dr. Datta. And also what we're seeing that fever tends to continue longer in this second phase. At times people recover and then day 21, 22, fourth week, it tends to come back. And you have no explanation why. It's not that it's a new infection. Also, I think we have seen more of secondary infections in the second wave, whether that's due to overuse of, steroids and earlier use of steroids or not, because in this second wave, you've seen that people have started self-medicating much more than what happened in the first wave. It may also be because probably they were not able to access healthcare facilities because the second wave was 4 times larger than the first. But these are facts that are there. Now, as regards, we did know in the first wave that it does affect the heart, many times subclinically. But we are seeing today that, tachycardia or increased heart rate, variation in heart rate is happening probably more often. We are still in the early days of the second wave, and we will know more in the next coming months how many people are going to have long-term effects of the heart, how many will have long-term effects of the lungs. In the first wave, we saw that even though we presumed early on that fibrosis would be a major component of the disease, it wasn't so. But we will know more in the second phase. What is also being seen is that there is a change in memory. There is what is being referred to as brain fade, which is happening. And many people who are not even very old, The elderly, of course, are experiencing this more, but even in the not so old people in their 40s and 50s, they are reporting this. And this report has come more from the Western part of the world. And we may not have seen this as much, or maybe we've not actually concentrated and tried to recognize this as much. Of course, when it affects the brain overtly, when you get encephalitis or you have strokes as a part of that, I'm not talking about that. I'm talking about something which is at a subclinical level, and it's with the maybe when tests are done, psychological tests are done, tests for cognitive function are done. That's when we may recognize this. This has been much more than what we saw in the first phase, and it's only in the coming months that we will know how much of a long-term effect it is going to have on the population.
Dr. Datta, can you just tell, some specific symptoms that one should look out for post-COVID and worry about, because now everybody's worried that am I being a hypochondriac, or actually am I missing a breath, or am I, is my heart beating faster? People are a little scared, but what are the symptoms one should really worry about?
Yeah, no, absolutely. As pointed out by Dr. Mahajan, it's a very protracted disease this time. I mean, last year we used to tell patients, 2 to 3 weeks and you'll be fine. Not for the severe cases, but for moderate, mild, definitely. And this year, regardless of whether it's been mild or moderate, it's just going on for weeks on end. And even in our hospital now, we see a complete turnaround. From acute COVID, it's gone to the, kind of the post-COVID people who are just lingering because they're still needing oxygen, or they've developed some other problems, or they've gone home and come back with fever. So yes, one of the first things is that protracted fever. Even in mild cases, the fever may abate for a while and then come back, or may just never go away, a kind of a low-grade fever, and everything else is fine. And I think these have been the circumstances under which a lot of steroids have been used to somehow try and curb that fever, which possibly didn't need curbing in some instances. But anyway, so we see that a lot, weeks. Now we've started thinking it's probably closer to a 6-week disease, possibly 8 weeks. Again, time will tell as we see the wave going on. So I think all symptoms do have to be taken, very seriously. Secondly, respiratory symptoms. I mean, respiratory symptoms, of course, if the lung is extensively involved, then, the respiratory symptoms are going to take a while coming down. Again, pointed out by Dr. Mahajan, last year we thought, there will be fibrosis, but then we realized it's not a progressive disease. It is a self-limiting, it starts, but then it's only recovery as things roll on for the vast majority. So we hopefully won't see that, or even if there is a lot of lung damage in the acute phase, hopefully that'll all resolve in the next several months to come. But I think what we are seeing, the overall trend is that just taking much longer. Yes, there is a subset of people who get better, get worse, come back with fever, and that is that, waves of cytokines, as they say, post, the systemic inflammatory syndromes that we see and things like that. A fast heart rate, very commonly seen again. That may be attributed to oxygen deprivation or breathlessness and things like that, but may also indicate some underlying cardiac thing. A lot of, brain fog and just disorientation and non-specific kind of things. And again, lung specific, you'd asked this earlier about, lungs collapsing. Yes, the lungs are so stiff. Lungs are supposed to be like elastic. And when that elasticity goes, they become so stiff that, they can puncture. And then you get pneumothorax, which is air leak out of the lungs, which compresses the lungs. And recovery from that, again, is like a lengthy thing. So I think for patients who have any doubt, they must seek an opinion from their physician rather than dismiss it as a, overthinking or anything like that. And of course, add to that, the repercussions of steroids like black fungus and all, then I think patients have to be made aware of what to look out for.
Dr. Monica, if you can just help us, walk us through, why is it happening? Have you been able to get a fix on that? And when should one really start worrying and rush to the doctor?
So just to get the thought process right, black fungus does not actually look black. It's a misnomer. So black fungus, we've seen a huge surge in the number of cases of mucormycosis or black fungus, as it is called by the layman. And typically, this is a fungus which is present in the air. It's something which is present all the year round in the air in the form of little spores of fungus. Now, when a normal human being breathes those spores of the fungus, our immune system is able to fight that and we don't end up getting any kind of infection. So, for a person with normal immunity, normal immune levels, the black fungus or the mucor will not cause any problem. It's there on food particles, it is there on decaying matter, it is there in the air throughout the year. It's always been there for years and centuries around. Now, what has triggered off this particular episode of black fungus is that we need to understand what is the role of steroids and what is the problem with the steroids. So, steroids are the hero of the story. We had a major trial called the recovery trial, and that showed us that when you give steroids in the second phase of the illness or the inflammatory phase of the illness, especially in people who require supplemental oxygen or have a moderate or severe disease, steroids save lives. So, steroids in this major recovery trial were the only thing that saved lives in moderate and severe COVID. Now, with half baked knowledge, what people started doing was that there was a rampant use of steroids. They've started using steroids even in the first week of the illness, where the virus is still multiplying and you don't need steroids, you actually worsen the situation. The second thing that happened was that there was such an overwhelming use of steroids that instead of using them for the shortest possible period, and mark my words, only in moderate and severe patients of COVID, they started using them in practically every patient of COVID, and for such prolonged periods that the hero of the story became the villain of the story. And steroids cause the sugars to shoot up. So a person who's diabetic will have sugars reaching 400 plus, and a person who's not had diabetes or is pre-diabetic will convert to diabetic. This fungus loves sugar. This fungus loves an acidic blood pH. So whenever the body sugar levels shoot up, the blood becomes more acidic, and that promotes this fungus to grow. It also thrives on iron, it thrives on ferritin. So this is an ideal scenario in which a person who's on oxygen, who's on steroids, and who's got all the acidity in his blood favoring the growth of this fungus. So these spores, when they enter in such a human being through his nostrils, through his nose, they kind of invade the body. And this is called as an angioinvasive fungus. It means that it invades the blood vessels, it invades the tissues, and it eats up the tissues. So this fungus classically causes a blackish, bloody nasal discharge from the nose. And that's why it has a little black spot or a scar inside the nose, and hence the misnomer black fungus. So if you don't pick up a patient of mucormycosis or black fungus on time and treat him, within 1 week, there is 100% mortality, 100% death in such a patient. So that is why the urgency in terms of explaining to the patients, especially post-steroid therapy, post-use of things like tocilizumab or monoclonal antibodies or other immunosuppressants, that when they are getting discharged from the hospital, they have to be explained that if you have a bloody nasal discharge, if you have a swelling or a pain on one side of the face, on one cheek, if you have blurring or a pain in an eye, or you have an overwhelming headache, these are the signs where the fungus may have entered from your nose, gone into your sinuses, gone and invaded your eyeball, and then proceeded on to involving the brain. So this fungus kind of eats its way around from entering from the nostrils and the sinuses up to your brain, and that causes fatality or death. So time is critical. The patients have to be forewarned that you are at high risk because you are diabetic, you've received steroids, you've received immunosuppressants. So please watch out for these symptoms after we are discharging you home. And if they do report with these symptoms, immediate hospitalization, no delay at all. Start treating them with antifungals and call the surgeons to just remove as much of the fungal invaded tissue as possible, so that you are removing the bulk of the tissue with the fungus so that the spread can be halted. So it's a joint effort between a physician and a surgeon to try and get rid of as much of fungus out of the body so that the rest of the healthy tissues can be saved. And more importantly, the lives can be saved. So it starts with patient education. It starts with a team approach, and it starts with a sense of urgency to kind of fight this black fungus.
Dr. Hashmalan, also, why are we seeing more cases of black fungus in India than anywhere else? And that's also one question that's coming up.
That's a moot point. In the first wave, there were cases. I think there were 97 reported worldwide and about 70 odd reported from India. But this time we are seeing it in the thousands. And as Dr. Monica has said, some facts are very clear that this is, after all, an opportunistic, organism. It's the conditions in the body have to be right. High sugar levels, which are there in diabetics. On top of that, you add steroids. That takes the level to a very high level. Then you have diabetic ketoacidosis, acidic medium fevers, increased ferritin levels, which are happening in COVID. So that becomes a combination, and these are factors which are known. But why is it that it's happening so much in India that we are now, we've caused a pandemic of mucormycosis? There are theories, and one theory, of course, is that there's been rampant use of steroids and there's been self-use of steroids, because this has happened even in patients who never went to a hospital, okay, who were treated at home, maybe got oxygen at home, and may not even have had rampant or very serious COVID. Why did they get it? And then, of course, within the hospitals, one of the theories which has been doing the rounds, it's a theory, a hypothesis, call it what you will, is about the oxygen and the quality of oxygen that was used. We do not have any evidence as yet, because without evidence, it remains just in the realm of, theory, which is that we did switch from using medical grade oxygen to industrial oxygen because of the acute need that was there of oxygen. And it has been theorized. Again, I will, qualify my statement by saying that because the kind of tankers, the production units, the cylinders that are used for industrial grade oxygen may not have the due diligence and the quality that is required for oxygen that is used medically, that may have some reason. And you do see that even in this wave, it is in the latter half of the wave that you had this problem. Remember that this wave started sometime in February in Maharashtra and in March, but you're getting these cases coming mostly in May. And it is in April really that we use this oxygen. So that is one of the theories that is given. And then there is theory about water being unhygienic and all that. It's not any reason. It was the same ICUs in the first wave. And why have non-COVID patients not got it? So there are theories and there are some known facts, medical facts. And I'm sure in the coming weeks, again, I keep repeating myself, we will know more about what could be the underlying reasons. But the fact is that today we don't have that huge requirement of oxygen because the cases have come down. And hopefully, if that was the reason, we would stop seeing more cases. But as Dr. Monica has pointed out, it's very, very important for patients who've received steroids or who are diabetic, who've had COVID, to have a very low index of suspicion.
Oh, I'll quickly let you go. Yeah, Monica, you want to say something?
So I need to just clarify 3 points here. A, steroids still save lives. So after all this black fungus hype, a lot of patients questioned as to why steroids were given. So let's understand that the only thing that has saved lives anywhere in the world is a judicious use of steroids. So as long as they are used correctly as a weapon, they save lives. When you misuse them or you have half-baked knowledge and you use them, then it is that they create a problem. The people who got mucormycosis sitting at home were actually the ones who did not get beds in the hospital. That is why they were on steroids and they were on supplemental oxygen at home. Otherwise, people treated at home will not get mucormycosis. That is the second point. And the third is in terms of the appropriate use of antifungals. If you use the wrong antifungal, which does not work against mucormycosis, then it is as good as not using an antifungal. It has to be the correct antifungal, correct treatment. So steroids used in all people is not a bad idea. Steroids have to be timed right. Steroids save lives. The choice of the antifungal has to be correct. And more importantly, if you get symptoms on one side of the nose, one side of the head, one eye, those are more meaningful than getting symptoms on both sides of the face and both eyes and both nostrils, because this generally will be a unilateral process. It will be a half side of the face which is involved rather than both the sides.
Bernali, do you want to add something to the black fungus conversation?
No, I think that was very comprehensive. I think almost everything has been covered. We occasionally, I mean, mucormycosis in our normal practice, we'd see maybe 2 to 3 a year in profoundly immunocompromised patients with transplant and things like that. And now suddenly this surge is obviously, as we have been through already, multiple contributing factors. But hopefully we are on top of that and we'll see it abating as the rest of the epidemic and the various, again, factors that have been already discussed. And I think I would completely agree with Dr. Monica in what she said about steroids. I think steroids are life-saving, period. It has been proven in COVID, and physicians who have used it in different situations know the value. We have saved lives. But unfortunately, it has gone into disrepute because of its, the abuse, the indiscriminate use, etc. And that is, I guess, part and parcel of the pandemic that we are going through, where we have all been caught unawares. We are completely overwhelmed by the sort of scale of it, and we don't necessarily have the means of containing it. Being in a hospital in a very contained environment is great, but if you look at the society, the community, the country as a whole, it's obviously a very dire situation, and people have just done whatever it took to try and come out of this illness, and of course there will be fallouts and ramifications, and I think that's what we are now dealing with, and let's hope all of this just starts abating.
On that note, that's a reassuring note and a hopeful note. But thank you all for really taking your time out. I really want to say that you all been doing your best, and more than your best in the last few months. It's been chaotic. The doctors are there at the front line. So thank you all for all that you've done and for taking time out to explain this to all of us, which I think my viewers are going to find very helpful. Thank you.
Thank you.
Thank you so much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.